In 2025, South Korea is about to enter a super-aged society, with more than 1 in 5 people over the age of 65. As a result, the number of elderly people visiting hospitals is expected to increase. During the same period, the number of hospitalized, outpatient, and pharmacy visits for the elderly reached 262.85 million. More and more people are complaining of difficulties in going to the hospital together due to work, school problems, or differences in residence. In particular, it is necessary to visit the hospital at least 5 times and at most 30 times for anti-cancer treatment, but it is not easy to give that much time. Chemotherapy requires more than 5 visits at 3 to 4 week intervals, and radiation therapy needs to visit the hospital about 30 times at 1 week intervals. Accordingly, the hospital accompanying service that helps the elderly to receive treatment at large hospitals on behalf of their children is attracting attention. Lee Sang-dul, CEO of MDeScourt, a hospital companion service company, explained, "I created a platform service in consideration of the case where children do not have enough time these days, when there are not many children." MDeScourt is a service created by incumbent medical staff. When it is difficult to move to the hospital alone due to inconvenient movement, or when anesthesia is required, such as surgery requiring anesthesia or sedation endoscopy, it is difficult for the guardian to accompany the hospital. Escorts, accompanying managers, who have experience in hospital work mainly work part-time to provide services. Representative Lee said, "These days, large hospitals have become complicated and have changed to unmanned systems such as kiosks. So there are many cases where it is difficult to take complete care even if the guardian follows." An escort who has been systematically trained by a nurse from a university hospital is helping with this. It is also expected to create jobs for those with relevant qualifications. MDeScourt estimates that there will be about 200,000 idle workers in terms of nurses, and about 3,000 nursing assistants and caregivers. In particular, it has the advantage of being able to work for a short period of time, part-time, even in conditions where full-time work is difficult due to childcare. CEO Lee said, "It is a service that matches a consumer with a medical license holder, supplier, who wants to work at the desired time." More and more people want to do it, he said. Representative Lee hoped that the burden of caring for his children would be reduced even a little. He said, "From the point of view of the child, since they are parents, the burden of having to personally take them to the hospital is great. Conversely, parents are also worried that they are indebted to their children," he said.